Common definitions.
Acute infection, a classification of infection characterized by symptoms that appear rapidly but generally disappear within a few days. Antiseptic solution, a substance that reduces the number of microorganisms present on the skin and mucosal surfaces. Approved. In the body art industry, something is approved when it has been deemed acceptable by the regulatory authority, such as the health department. Practitioner, artist. Any person who is registered with the regulating authority, like the health department, who controls, operates, manages, conducts, or practices body art procedures at a body art facility and who is responsible for compliance with these regulations, whether actually performing body art procedures or not. Blood exposure incident, when the skin is pierced through such events as a needle stick, cut, or abrasion from material contaminated with blood from a client. Or, if the eye, mouth, or other mucous membrane or non-intact skin comes into contact with blood or blood-contaminated material from a client. Bloodborne pathogen, a disease-causing microorganism that, when present in the blood, can be transmitted to humans, including, but not limited to, hepatitis B virus (HBV), hepatitis C virus (HCV), and human immunodeficiency virus (HIV). Body art, the practice of body adornment by permitted establishments, operators, and registered techniques, body piercing, tattooing, branding, or application of permanent cosmetics. This definition does not include practices that are considered medical procedures by the state medical board, such as implants under the skin, which must not be performed by a body art facility. Body art facility, the specified building, section of a building, or vehicle in which a practitioner performs or demonstrates for the purpose of instruction, body art, including reception areas, the procedure area, and the decontamination and sterilization area. A body art facility should be completely separated from living quarters. Body art facility does not include a facility that only pierces the ear with a disposable, single-use, pre-sterilized clasp and stud or solid needle that is applied using a mechanical device to force the needle or stud through the ear. Body piercing, the creation of an opening in a human body for the purpose of inserting jewelry or other decoration. Body piercing includes, but is not limited to, the piercing of an ear, including the tragus, lip, tongue, nose, or eyebrow. Body piercing does not include the piercing of an ear, except for the tragus, with a disposable, single-use, pre-sterilized stud and clasp or solid needle that is applied using a mechanical device to force the needle or stud through the ear. Branding, the process in which a mark or marks are burned into human skin tissue with a hot iron or other instrument, with the intention of leaving a permanent scar. Chronic infection, an infection is considered chronic when it is long-lasting or recurs regularly. Client, an individual upon whom a practitioner performs body art. Contaminated, in the case of bloodborne pathogens, something is considered contaminated when there is the presence, or reasonably anticipated presence of blood, bodily fluid, or other potentially infectious materials in, or on the surface of an item. Contaminated waste, any contaminated materials generated during body art procedures that are to be disposed of. Contaminated sharps, an item that contains an infectious substance and can also break the skin. Some examples include any broken glass tubes, vials, glasses, needles, or dental wires. Disinfectant, a product that is registered by the Federal Environmental Protection Agency and the Department of Pesticide Regulation, as indicated on the label, to reduce or eliminate the presence of disease-causing microorganisms, including human immunodeficiency virus (HIV) and hepatitis B virus (HBV), for use in decontaminating work surfaces. Disinfection, the effective treatment of clean equipment to destroy or significantly reduce the number of pathogens. It is not the same as sterilization. Decontamination, the action of removing any infectious substance. Both physical and chemical means can be employed to remove blood or other pathogens from surfaces and items to ensure that they cannot be transmitted. It is also used to ensure that items are safe to dispose of, use, or handle. Engineering controls, protocol steps that are put into place to decrease the likelihood of contamination. Some examples include needle-less systems, sharps with built-in protection, altered medical devices, sheathed needles, and containers for safe disposal of sharps. The purpose of these measures is to decrease or eliminate the chance of bloodborne pathogens becoming a workplace hazard. Exposure incident: an incident that occurs as an employee is performing their regular duty. The employee comes into contact with a possible infectious substance or blood in their eye, mucous membranes, mouth, or non-intact skin. Hand washing facility: the area where employees have direct access to clean, potable water, a disinfectant or cleanser, and air-drying machines or personal paper towels. Infection prevention control plan: a written plan that applies to all those who perform tattooing, the application of permanent cosmetics, body piercing, or branding within a California body art facility. It describes how the applicable requirements of California's regulations will be implemented. It is designed to eliminate and minimize employee and client exposure to bloodborne pathogens and other infectious diseases. Informed consent form: a document that every client must read, fill out, and sign before any body art procedure. The consent form must include a description of the requested body art procedure, a description of what the client should expect following the procedure, including any medical complications that can potentially occur, a statement informing clients of body art permanence, and post-procedure instructions discussing how to care for new body art and piercings, what clients should and should not participate in while body art heals, and signs and symptoms of possible infection in body art and piercing sites. Instruments: in the body art industry, an instrument is defined as equipment for tattooing, applying permanent cosmetics, body piercing, or branding. Such equipment includes, but is not limited to, needles, needle tubes, forceps, tweezers, pliers, branding wires, irons, rods, stencils, or other implements used to insert pigment, pierce, puncture, burn, cut, or be inserted into any part of the human body for the purpose of making a tattoo, permanent hole, or scar. This term also applies to studs, hoops, rings, or other decorative jewelry or materials intended to be inserted into any part of the body for the intended purpose of placement in a hole resulting from piercing. Jewelry: any personal ornament inserted into a pierced area. To be appropriate for body art, jewelry must be made of surgical implant-grade stainless steel, solid 14-karat or 18-karat gold, niobium, titanium, or platinum, and be free from nicks, scratches, or irregular surfaces. Jewelry must be properly sterilized prior to use. Medical history questionnaire: a document that every client must read, fill out, and sign before any body art procedure. The questionnaire must include whether or not the client may be pregnant, whether or not the client has a history of diabetes, cardiac valve disease, hemophilia or other bleeding disorders, allergic reactions to latex or antibiotics, or herpes infection at or near the requested body art site, whether or not the client has a history of medication use or is currently using medication, including prescribed antibiotics for use before dental or surgical procedures, and any other factors that may put the client or body artist at risk for bloodborne pathogen exposure. All information provided on the medical history questionnaire is considered confidential. Minor: any person under the age of 18 years. Needleless systems: a system that does not require the use of needles when performing procedures. Owner: the person or persons whose name or names appear on the health permit, business license, property deed, or rental agreement of the body art facility, or a person acting as a principal of a corporation or partnership employs practitioners to perform body art. Permanent cosmetics: the application of pigments under the skin of a human being for the purpose of permanently changing the color or other appearances of the skin. This includes, but not limited to, permanent eyeliner, eyeshadow, lip color, areola color. Pre-sterilized: instruments or procedure setups that are sold individually packaged and sterilized. Each package shall have an auditable sterilization lot number from a sterilization facility. Procedure area: a room, or designated portion of a room, that is set apart and only used to perform body art. Procedure site: the area or location on the human body selected for the placement of body art. Sharp: any object that may purposely or accidentally cut or penetrate the skin or mucous membranes, including, but not limited to, needles and razors. Sharp's injury: any injury caused by a sharp, including, but not limited to, cuts, abrasions, or needle sticks. Sharp's injury log: A written or electronic record of all work-related needlestick injuries and cuts from sharp objects that are contaminated with another person's blood or other potentially infectious material. You must enter the case on the OSHA 300 log as an injury. To protect the employee's privacy, you may not enter the employee's name on the OSHA 300 log. Sterilization. The complete destruction of all microbial life forms, including spores. Tattooing. The insertion of pigment in human skin tissue by piercing with a needle. Tragus. The cartilage on the outer ear in front of the ear opening. Unlike other ear piercings, tragus piercings are considered body piercings. Universal precautions is an approach to infection control. According to the concept of universal precautions, all human blood and certain human body fluids are treated as if known to be infectious for HIV, HBV, HCV, and other bloodborne pathogens. Workstation. The area within a procedure area where a practitioner performs body art. The workstation includes, but is not limited to, the client chair or table, counter, mayo stand, instrument tray, storage drawer, and practitioner's chair. California Occupational Safety and Health Administration Bloodborne Pathogens Standards. The Occupational Safety and Health Administration (OSHA) requires that people who might come into contact with bloodborne pathogens in the workplace, including body artists, are trained to deal with this hazard properly. To access the Occupational Safety and Health Administration guidelines, click on the link below. California Safe Body Art Act. The state of California also has bloodborne pathogen training requirements for body artists. These statewide standards are applicable for the regulation of persons engaged in the business or performance of tattooing, body piercing, branding, and the application of permanent cosmetics in California. These requirements are intended to protect both the practitioner and the client from the transmission of infectious diseases through the application of proper body art procedures and the control of cross-contamination of instruments and supplies. To access the Safe Body Art Act, click on the link below. Transmission, control, and symptoms of diseases caused by bloodborne pathogens. Pathogens are tiny, microscopic creatures that cause diseases. Types of pathogens may include bacteria, viruses, and parasites. There are many ways pathogens can be transmitted, including through the air, on doorknobs, through a handshake, or even through contaminated water. Bloodborne pathogens, however, can only be spread through blood-to-blood contact, either directly or indirectly. An example of direct contact would be if you had an open cut on your hand and that cut touched your client's blood or another body fluid during a procedure. Indirect exposure can happen if, for example, you were to touch a clean doorknob with contaminated hands. The pathogen would then be on the doorknob, and if someone touched the doorknob with a cut or scrape on their hand, the pathogen could be transmitted into that person's blood. Protecting yourself from bloodborne pathogens comes down to avoiding touching blood, a contaminated object, or other potentially infectious materials. OPIM, other potentially infectious materials. Other human body fluids and any possibly infected human body tissues like semen, vaginal secretions, saliva, or any body fluid that is visibly contaminated with blood, and all body fluids in situations where it is difficult or impossible to differentiate between body fluids. Direct and indirect contact transmission occurs when an uninfected person comes in contact with an infected body fluid or an object or surface that has previously been contaminated. There needs to be a sufficient amount of pathogens present in a body fluid for it to be infectious. Although not all body fluids are infected with bloodborne pathogens and the amount of pathogens may not be sufficient to infect the fluid, it is impossible to test the fluid immediately and guarantee that it is safe. Therefore, it is better for body artists to always be cautious and avoid contact with all body fluids at all cost. Susceptible host. For an infection to occur, the microorganism must find a susceptible host. That is, not all people are suitable hosts for infections. Some individuals are able to develop resistance to certain diseases while others are born with natural immunity. What this means is that these people will not get infected if exposed to a bloodborne pathogen. For instance, certain populations in Africa with sickle cell anemia have natural immunity to malaria, and the human hardly contract chicken pox the second time since the body has acquired the ability to resist the pathogen. Immunity can also be created artificially. Injecting dead or weakened forms of certain pathogens can teach your body to recognize and fight those diseases in a low-risk situation. This process is called vaccination. Not only can the human body gain immunity naturally, it can also gain immunity artificially by receiving dead or weakened forms of certain pathogens to build the ability to recognize and resist those bacteria. The body is introduced to such situations through a process called vaccination. Working in the body art industry, the likelihood of coming into contact with common bloodborne pathogens, such as hepatitis B, is relatively high. Therefore, every body artist should receive vaccinations for such diseases and take every precaution carefully, as vaccination is not foolproof. There is still a very low chance of contracting a disease even one is fully vaccinated. Entry point. Besides a susceptible host, a bloodborne pathogen needs an entry point to infect a body. One of the most common for a pathogen to find a way to infect a host is through a cut or scratch on the skin, which is the most important barrier of the immune system. After finding an entry point on the skin, the pathogen can now enter the bloodstream and reproduce and sustain using resources in the body. With proper techniques, a body artist can prevent bloodborne pathogens from finding an entry point on the body. Bloodborne diseases. Hepatitis. Inflammation of the liver. There are 5 viral hepatitis viruses, normally referred to as type A, B, C, D, and E. However, as a body artist, it is more important to focus on preventing hepatitis type B and C, since type A and E are not bloodborne and type D is rarely found in the US. Hepatitis is a very dangerous disease as it is the leading cause of liver cancer. The liver will not be able to function properly if inflamed or swelling. Certain strains of hepatitis such as B and C may cause chronic liver illness and permanent damage to the liver. According to the Centers of Disease Control, there are over 60,000 new cases of hepatitis infections each year, and there are an estimated 3.5 million cases of people living with hepatitis chronically. There are multiple ways to transmit hepatitis types B and C, including during childbirth, unprotected sex, or sharing needles. A person can contract hepatitis through direct contact with infected blood or open sores, or in direct contact with contaminated objects. Working as a body artist might expose to hepatitis if an infected tattoo or piercing needle accidentally cut or scrape your skin. This would create an entry point on the skin, allowing hepatitis pathogens to enter the body. Human immunodeficiency virus (HIV). A hazardous and dangerous bloodborne virus that deteriorates the immune system by attacking certain white blood cells. Since these white blood cells are needed to protect the body from infections, without them, the body will lose the ability to fight back harmful microorganisms that cause diseases. An outcome of HIV infection is acquired immune deficiency syndrome (AIDS). This disease severely weakens the immune system, increasing the likelihood of contracting infections and illnesses that would otherwise be harmless to a normal person. A body infected with HIV/AIDS is vulnerable to various physical and neurological complications. In 2016, there are over 1.2 million people living with HIV/AIDS in the United States and over 15,000 deaths among people with diagnosed HIV. HIV and AIDS transmission. There are 3 common ways to contract HIV pathogens: sexual intercourse with an infected partner, direct or indirect contact with infected body fluids, and from mother to child in the womb or through breastfeeding. HIV pathogens can be found in various body fluids, mostly concentrated in blood. Therefore, it is inevitable to contract HIV if infected blood touches an open wound or sore. One important thing to keep in mind is that a person can contract multiple strains of HIV virus, meaning even if a person is HIV positive, they can still contract a different type of HIV. And the body is incapable of defending and fighting the pathogens. The window period, the time it takes for the virus to show up in tests, can range from 2 to 8 weeks to 6 months. For the HIV virus to progress to AIDS, it typically takes 9 months. However, with modern treatment, scientists have been able to delay AIDS progression on patients from 10 to 20 years. HIV and AIDS prevention. While there are treatments available to extend a patient's life by several months to years, it is still safest and least expensive to prevent the HIV pathogens from entering the body. Currently, there is yet to be a cure for HIV. However, HIV can be prevented by 81% when promptly treated with post-exposure prophylaxis, or PEP. If you think you may have been exposed to HIV-infected blood or other body fluids, talk to your healthcare provider or a doctor right away. PEP must be started within 72 hours of exposure in order to get the best result. Therefore, to ensure yours as well as your client's safety, it is best to take every precaution needed to avoid spreading contaminated body fluids and blood. Staphylococcus aureus, staph. A pathogen commonly found on the skin or in the noses of healthy people. Staph infections used to be effectively treated using common antibiotics in the past. Unfortunately, that is not the case anymore. Some staph bacteria, such as methicillin-resistant Staphylococcus aureus, MRSA, accounting for 2/3 of staph infections, have developed resistance to common antibiotics. Staph infections, including MRSA, usually result from direct or indirect contact with infected persons or contaminated surfaces and objects through cuts, scratches, or open sores on the skin. Keeping these areas clean and bandaged and washing your hands frequently will go a long way toward preventing staph infections. A typical external wound normally develops minor staph infections that remain localized at the site. However, if these pathogens are able to enter the bloodstream and infect the body, serious infections, including septicemia or blood poisoning, can set in. Whereas localized infections are fairly easy to treat, serious infections are often untreatable and fatal. The incubation or window period ranges from 2 to 10 days. Staph and MRSA prevention. There is currently no vaccine to protect the body against staph. Hence, to prevent staph infections, simply keep open sores and cuts clean and bandaged and regularly wash your hands. Properly clean and prepare your client's skin with alcohol prep pads before any procedures to protect them from contracting staph. Advise clients to see a doctor or healthcare provider if there is any unusual and excessive inflammation after a procedure. Group A Streptococcus (GAS) is also commonly found on the skin and in the throats of healthy people. When GAS enter the bloodstream, the resulting infections, necrotizing fasciitis and streptococcal toxic shock syndrome (STSS), are often fatal. Necrotizing fasciitis, a bacterial infection that destroys tissues under the skin. Symptoms include blisters, red and purple skin at infected site, fever, and pain. The disease spreads rapidly and results in the death of soft body tissues. That's why people often mistakenly call it flesh-eating disease. STSS disease sets in when streptococcal bacteria release superantigenic toxin in the blood. STSS is a very rare yet deadly complication of strep infection. This disease has a fatality rate of 70% to 100%. Group A Streptococcus transmission. Unlike typical GAS infections, which spreads through direct contact, necrotizing fasciitis and STSS complications result from pathogens that are present on the skin entering the body via a cut or open sore. The window period ranges from 1 to 10 days after contracting strep bacteria. Group A Streptococcus prevention. The best way to prevent strep infections is to properly clean and prepare your client's skin before any procedures. Also, your clients should take extra precautions to keep their new tattoo or piercing as clean as possible until the wounds have healed. Malaria, a parasitic illness transmitted by the bite of infected mosquitoes. Malaria is quite rare in the U.S., with fewer than 20,000 reported cases. However, immigrants and international travelers have higher likelihood to contract this disease. Symptoms of malaria include fever, chills and sweating. Untreated malaria can cause organ failure and death. Syphilis, A bacterial infection spread by sexual and blood contact or from mother to child. Syphilis develops in stages throughout several years, with different symptoms associated with each stage. Late stages of syphilis can lead to organ failure and damages to the eyes, brain, bones, blood vessels, central nervous system, and heart. While syphilis is treatable with the help of healthcare professionals, it can be fatal if left untreated. Malaria and syphilis transmission. Body artists should take precaution as malaria and syphilis can be transmitted through blood-to-blood contact. Therefore, body artists must take every precaution to avoid spreading the diseases through potential entry points. The window period for malaria ranges from 7 to 30 days, while that of syphilis is usually 3 weeks. Malaria and syphilis prevention. Malaria and syphilis can be prevented by keeping the work area and surfaces clean, avoiding direct contact with blood and other body fluids, and bandaging open wounds. Herpes simplex. A viral infection that can cause outbreaks of sores and blisters. It spreads rapidly through direct contact with a person who carries the virus. While herpes is not a bloodborne disease, body artists still have to take precautions as performing body on the infected site may irritate the infection and body artists may risk contracting the disease. Herpes normally go away without treatment within a few weeks. However, the disease is highly contagious and clients may spread the herpes to other parts of their body, including their eyes, genitals, and brain. Personal protective equipment. While the risk of getting an infection is relatively low for body artists, it is much higher for clients. When performing a body art procedure, such as permanent makeup, tattoos, or piercings, body artists are essentially creating entry points for dangerous bloodborne pathogens to enter the body on the clients. So, it is important to take preventive measures, generally called universal precautions, to keep bacteria from contaminated surfaces to enter the body. Universal precautions. Since there is no way to test the safety of a person's body fluids or blood, it is best to assume that they are infected. Therefore, body artists should follow certain practices and proper techniques to ensure the safety of both them and their clients. The first barrier that first helps prevent exposure to hazardous materials is engineering controls. They refer to protocol steps that are put into place to decrease the likelihood of contamination. Some examples include needleless systems, sharps with built-in protection, altered medical devices, sheathed needles, and containers for safe disposal of sharps. The purpose of these measures is to decrease or eliminate the chance of bloodborne pathogens becoming a workplace hazard. Besides engineering controls, body artists need to create an extra layer of personal protection. Personal protective equipment (PPE) refers to clothing and tools that help minimize the exposure to hazardous materials during a procedure. PPE includes gloves, masks, aprons, and safety glasses. Gloves. To body artists, gloves are the most important of all PPE since your job mostly involves your hands. However, you cannot risk exposing your hands and your clients to pathogenic bacteria. That's why you should always take extra precautions by using gloves with proper techniques. Just like other equipment for a body art procedure, there is a wide range of different gloves you can choose from. Among these options, latex gloves are one of the most popular choices due to their flexibility and low prices. However, you may want to reconsider and opt for a different type as many people are severely allergic to latex. Its effects range from skin irritation to life-threatening shock. If you do decide to go with latex gloves, it is a good idea to have an alternative option for latex allergic clients. Since latex breaks down easily, you should also change your gloves every 20 minutes and wash your hands following safety protocols. Other options include PVS gloves, nitrile gloves. Nitrile gloves allow for a broader range of hand motion without causing any allergic reactions like latex. Gloves effectively create a barrier for you and your clients, preventing bloodborne pathogens from being spread from the skin to your hand or other surfaces and vice versa. The proper way to put on a new pair of gloves is as follows. The most important thing when putting on gloves is to avoid hand contact with the outside of the gloves. Even though you have washed your hands before putting the gloves on, pathogens can still be present on your hands and contaminate your gloves, defeating its purpose. To start, use your thumb and pointer finger to slightly pinch the cuff of the first glove, touching as little and close to the outer edge of the cuff as possible, and pull it over your other hand. Next, grab the other glove with your gloved hand and slide your other hand into it. For the best performance, the gloves should not be too tight nor too loose. After putting on the gloves, you should never touch anything besides your equipment, tools, and your client. If the gloves come into contact with your body, clothes, or any other surface, it will be considered contaminated. To remove your gloves, follow these steps to avoid cross-contamination. First, take your index and middle finger to stick them underneath the cuff and pull it entirely off your fingers. Then, using the gloved hand, ball up the discarded glove in your palm. Repeat the first step with the other hand, pulling the second glove off your hand with your index and middle finger. As you pull the second glove off, it should be turned inside out, containing the first glove inside. Dispose of the gloves in the trash as they have been contaminated with blood. This technique will prevent any pathogen from the gloves to spread to your hands and arms. Make sure to wash and sanitize your hands after removing the gloves. You must change your gloves every time you switch between tasks. For example, you are working on a client and someone delivers a package to you. In this situation, you need to use proper techniques to remove your gloves, receive the package, wash your hands, and then put on a new pair of gloves. The used gloves should be discarded in the trash as they have been contaminated with blood. Other PPE may be used as preventative measures during a body art procedure. Aprons and bibs prevent pathogens from spreading from your clothes to the client and vice versa. Masks and eye protection prevents bloodborne pathogens from entering the body through the eyes and mouth. They will protect you in case you encounter spraying or splashing of infectious materials, which rarely happens at body arts facilities. It is also good to use a mask if you are working close to a client's face, although masks may not protect you from airborne pathogens. During a body art procedure, you should also wear aprons or bibs as they will prevent bloodborne pathogens from traveling from the body fluids to your clothes and vice versa. If you use different kinds of PPE, you should follow a specific order to optimize safety and performance. Aprons and bibs are the first to go on, then masks and eye protection. Since your gloves will directly touch the client's skin, you should save the gloves for last to avoid contaminating them. After the procedure, take off your gloves first, then your eye protection. Remove your aprons and masks last to avoid contaminating your face and clothes. Now that you are able to grasp the importance of universal precautions in preventing the spread of pathogenic diseases, it is time to discuss sanitation in the workplace. Not only can bloodborne pathogens enter your work area through direct or indirect contact with blood or other potentially infectious materials, they can also contaminate your facility as they are carried on your skin and clothes. As a matter of fact, you are probably carrying staph bacteria on your skin right now. If the facility is not often sanitized properly, the pathogens will inevitably spread to other surfaces, such as counters, chairs, carts, shelves, etc. It is best to prevent pathogens from spreading and contaminating surfaces before they get a chance. Two main methods of eliminating bloodborne pathogens from a surface are sterilization and sanitization. Antiseptics, antimicrobial substances that cleanse living tissue, skin. Antiseptics include antimicrobial soap, iodine, rubbing alcohol, and hydrogen peroxide. Antiseptic are available in a broad range of selection. You should choose ones that do not dry out the skin but still safely and effectively eliminate pathogens. To clean and prepare the skin before a body art procedure, gently wipe the skin with an antiseptic pad in circular motion and avoid touching the skin after cleansing. Antiseptics are to be stored away from food and medicine. There are several methods to store antiseptics that will prevent contamination. You can pour an appropriate amount from the original container to a smaller container. Another method is to store antiseptic in a pump bottle. Sterilization is the process of killing all microorganisms on a surface, pathogenic or not. Reusable equipment and tools, such as pigment stands, stylus, and casing, used in a body art procedure must be properly sterilized before the next use. Piercing or tattoo needles should never be sterilized and reused. After a procedure, they should always be disposed of in the sharps waste container. Sterilization practices. To start the sterilization process, first clean the items with water and detergents or enzymatic cleaners. You may need to use cotton swabs or Q-tips to clean off the residue. Generally, after a tattoo or piercing procedure, tools and equipment must be pre-soaked or pre-cleaned to prevent the drying of blood or tissue. Since residue and debris act as a barrier to sterilization agents, thoroughly cleaning items beforehand will prevent these matters from interfering with the sterilization procedures. You may want to place the pre-soaked items into a mechanical cleaning machine, utensil washer, sanitizer, ultrasonic cleaner, washer sterilization, etc. to clean the items more effectively and decrease worker exposure to blood and body fluid. All used items in the procedure must be considered contaminated and handled with gloves. Items that have more than one removable part should be disassembled, and delicate or heat moisture-sensitive items may need careful cleaning by hand. You should wear rubber or plastic gloves when handling or cleaning contaminated tools and equipment. Face masks, eye protection, and gowns provide an extra layer of protection from the splashing of blood and other potentially infectious materials. Since the items must be dry before the next step, allow them to air dry on a drying rack or a clean towel. After the items are pre-cleaned and dried, you should package the items in pre-approved sterilization pouches. Not all materials may be used as sterilization packages, since the item's sterility must be maintained until the point of use. Typically, each item needs a separate pouch for sterilization. However, some items may be packaged in the same pouch if they will be used at the same time. Say you open a package with multiple items but decide to use only one, then you must repeat the sterilization steps for all items in the package. Make sure to put down your name and date on the package for future reference. It is a good idea to include an indicator to monitor if the package has been effectively sterilized. When loading the sterilizer, allow for proper sterilant circulation. Perforated trays should be placed so the tray is parallel to the shelf. Non-perforated containers should be placed on their edge like basins. Small items should be loosely placed in wire baskets, and peel packs should be placed on edge in perforated or mesh bottom racks or baskets. Body art facilities are required to use autoclaves, sterilizers manufactured for sterilization of medical instruments, steam. No dry heat sterilizer. Use a pre-approved sterilizer, normally an autoclave, to sterilize the packaged items. Follow the instructions of the sterilizer to properly and safely operate the device and sterilize the items. You are required by law to provide a sterilization log if an enforcement officer requests to see it. To maintain a sterilization log, create an entry, which should include the date and your name, on the log every time you sterilize a tool or equipment. If there is any issue with the instrument, you can trace back the errors during the process with a well-documented log. You should keep old logs for at least 3 years. You should repeat the sterilization procedures when the package is not opened for use within the appropriate time. There is staining on the package, meaning the item has not been properly sterilized. Run what is called a spore test at least once a month to make sure that your sterilizer is operating safely and properly. Users should follow the manufacturer's directions for how to place the biological indicator in the sterilizer. Since sterilization is a complicated and time-consuming process, body artists may opt for single-use tools, such as casing, stylus, and ink cups. Cross-contamination. Bacteria or germs being transferred from blood or other potentially infectious materials to other objects and surfaces. At a body art facility, it is of utmost importance to avoid cross-contamination. Bacteria and germs can be carried on almost any surface, including your skin and clothes. These pathogens can be picked up from anything you come into contact with at home or at work. Say you are in the middle of a tattoo procedure and your ink is running low. You are alone in the facility, so you decide to pause the procedure to restock your ink quickly, with your gloved hands. The ink bottle is now cross-contaminated with the pathogens on your gloves. The next body artist who uses the ink bottle will now cross-contaminate other surfaces and objects they touch afterwards. They may also contaminate their tools and transmit the pathogens to other clients in the process. You must remove your gloves using the techniques previously shown in the book before restocking your ink. Make sure to wash your hands and put on new gloves before proceeding. It is also good practice to sanitize equipment periodically to prevent cross-contamination. Let's look at picture A. If this practitioner were to work on her client with those gloves, she might risk contaminating her client's skin with the bacteria from her clothes. Since every surface your clients might touch could be contaminated within a short period of time, it is a good idea to clean and sanitize your work area and the floor both before and after a procedure. Sanitization. While sterilization is the most effective way to eliminate pathogens on a surface, it is not practical for large surfaces, such as counters, chairs, or shelves. In such cases, sanitization is a better solution to keep the facility clean. People often use the terms sterilization and sanitization interchangeably. However, sterilizing a surface will kill all pathogens present on it, whereas sanitization only reduces the number of bacteria to a small enough number that they cannot cause any harm. Disinfection. To keep you and your clients safe, it is important to inform and educate yourself on how to safely and correctly use disinfectant to keep your workplace clean. When it comes to choosing the right disinfectant, pay close attention to the labels. A good way to decide if a disinfectant is suitable for your body art facility is by checking EPA, U.S. Environmental Protection Agency, registered product. Disinfectants that are EPA registered will guarantee to do their jobs properly. Some commonly used EPA registered disinfectants are barbicide, maticide, and cavicide. As mentioned before, common cleaners and disinfecting wipes will not be able to remove pathogens sufficiently from surfaces. Each disinfectant has its own set of instructions when it comes to usage and storage. Make sure to follow these instructions closely. For example, some may require pre-cleaning before use, some may have to be on the surface for a certain amount of time, while some may only work if diluted. Instructions vary from different manufacturers and different disinfectant types. In general, it is best to store disinfectants in their original containers, with tightly closed lids, and placed in a cabinet away from food and medications. Label chemical containers with the common name of the chemical and the manufacturer's instructions. The process of sanitizing an object or surface is as follows. Use any all-purpose cleaner to wipe down and clean the objects and surfaces of dirt and debris. You may want to choose a cleaner that will not corrode the surfaces or equipment. Allow the solution to sit for a required contact time to ensure maximum effect. Each sanitizer has a different required contact time. Use disposable paper towels to wipe the solution away. Be aware that disinfectant wipes and common cleaners are not strong enough to kill pathogens. As a body artist, there is a low chance you will have to handle a large amount of body fluids or blood. In case you do, there are certain steps you need to take to clean up the spill. Before starting to clean, you need to put on gloves to avoid contaminating your hands. If needed, you may also wear eye protection and a gown to keep your eyes and clothes clean. Then, use paper towels to soak up the fluids before gently pouring a diluted bleach solution over the spill. Allow the solution to sit for a required contact time, typically at least 5 minutes. Next, clean up the paper towels and dispose of them in the trash. Lastly, use clean paper towels and sanitizer to wipe up the area. Remember to disinfect the entire spill before cleaning up if there is any broken glass or sharp objects in the spill. Make sure to use forceps, pliers, or a broom and dustpan to clean up the spill and dispose of the objects in the sharps waste container. Do not pick up the objects or glass with your hands. Proceed to clean up the spill with disinfectants. Hand hygiene. Hand hygiene is one of the most important precautions when it comes to protecting yourself and your clients from dangerous bloodborne diseases. Even though gloves do provide an extra layer of protection to your skin, as a body artist, you still need to wash your hands properly to reduce bacteria and remove dirt and oil. Just by following a few simple and easy steps to wash your hands, you have effectively prevented the spreading of pathogenic diseases to your clients, yourself, and other objects around you. Hand washing procedures. One of the most important parts of universal precautions is hand washing, as it prevents the spreading of bloodborne pathogens. Follow these procedures to properly wash your hands. Wet your hands with clean, running water. The water should be at least 100 degrees Fahrenheit or about 38 degrees Celsius and as warm as comfortably possible. With liquid soap, lather your hands and scrub your palms, the back of your hands, between your fingers, under your nails, your wrists, and lower arms. Scrub for at least 15 to 20 seconds. Hum the Happy Birthday song from beginning to end twice, and that should be enough time to effectively wash your hands. Rinse your hands thoroughly with clean, running water. Dry your hands with clean disposable paper towels or a warm air dryer. Paper towels should be dispensed from a wall-mounted touchless dispenser. Do not skip any of these steps. Hand antiseptics helps reduce the amount of bacteria on your hands but does not remove dirt and oil. So, it cannot replace hand washing and can only be used as an additional precaution. Always make sure to properly wash your hands before using hand antiseptics. To use hand antiseptics, apply an appropriate amount of antiseptics to your hands and rub all the surfaces of your hands, including between your fingers, together until they are dry to sanitize your hands. Sharp items should only be disposed of in the sharps waste container, not the traditional waste containers. A sharps waste container should be clearly marked with labels. It should be puncture-resistant, leak-proof, and difficult to open once sealed. Locate sharps waste containers within arm's reach or as close as possible to the procedural area to avoid carrying sharps for long distance. Needles, disposable razors, and microblading tools need to be disposed of in the sharps waste container. Contact approved waste management providers and services to discard the sharps waste container once it is 3/4 full. A sharps waste container is considered full when it is 3/4 filled, since a completely full container will present potential for accidents to occur when you dispose of a sharp. Maintain a sharps waste log at your facility for reference and keep old logs for at least 3 years. You are required by law to present these logs to an enforcement officer upon their request. Except for sharps waste, you should discard any piece of equipment, tools, or materials that have come into contact with blood or opium in a traditional waste container. After a body art procedure, discard these items in the traditional waste container: protective gloves, paper towels, plastic protective covers, wraps, pigment ring cups, leftover pigment, cotton swabs, leftover ointment, used paper towels, food, paper, etc. Procedural safety. To ensure your and your client's safety, cleanliness is the utmost importance in a body art facility. That's why you should always wear gloves when setting up for a procedure to prevent the spreading of pathogens. First, using a germicide, thoroughly clean the procedural area. Then, cover the area with plastic wrap, sanitary sheet, tray cover, or paper towel before setting up the rest of the equipment. You must sterilize or throw away everything after a procedure. Needles are never to be sterilized and always to be thrown away. Since it is not practical to throw out a whole container, bottle pigment, anesthetic, or ointment, make sure to put the amount needed in a small pigment cup for use during the procedure. As for ointment, you can opt for smaller-sized, single-use packets or use a tongue depressor to get the amount needed. You should try to estimate an enough amount for a whole procedure so that you don't have to restock during the procedure. In case you need to restock, remove your gloves, restock, wash your hands properly, put on a new pair of gloves, and then proceed. You should have the tools and equipment needed for the procedure ready on a clean surface within arm's reach, preferably on a single tray medical cart to avoid misting contamination. Before the client is ready for the procedure, all items must be kept in their sterile packages. Remember to check your needles before a procedure for any defects to ensure maximum results. Always throw away needles after just one single use. Other items must be either thrown away or sterilized after use. Since you don't want to throw away ink bottles or anesthetic bottles after just one single use, you must put the ink and numbing gel in small ring cups. No animals, except for service animals, are allowed in the procedure area as they may carry pathogens and interfere with the procedure. Disassemble. After finishing a procedure, take off your gloves and dispose of them in the traditional waste container. Properly wash your hands and put on a fresh pair of gloves. Remove everything in the procedure, including barrier film, plastic cover, tubes, pigment cups, and paper towels in the traditional waste container. Place the needle in the sharps waste container. As for reusable items, pre-soak them in an enzymatic solution or all-purpose cleaner to prepare for sterilization. With a germicide, spray the work area and wipe it down with paper towels. Then, remove your gloves and dispose of them in the appropriate container. You will need to wash your hands again with soap and water after disassembling the procedure area. Tattoo procedure. Change into a new pair of gloves after you've set up and ready for the procedure. To prepare skin for the procedure, use a disposable razor to shave and cleanse the skin with antimicrobial soap. Then, with an alcohol prep pad, wipe the skin to prevent staph and strep infections. If you are using stencils for your designs, they need to be single-use and disposable. For freehand design, use a disposable surgical marker. As the tattoo needle moves rapidly across the skin, it can create a mist from the blood on the skin. This mist can contaminate anything positioned beneath the procedure surface. You must throw out any equipment and tools positioned below the procedure. Stock equipment and pigment bottles must be stored above the procedure level to avoid misting contamination. It is best to protect yourself against dangerous pathogens after your body art procedure. Your body artist may give you antibiotic ointment or petroleum jelly to put over your fresh tattoo. Only apply a thin layer to avoid germs and particles in the air from getting stuck on the ointment. Piercing procedure. Safety precautions in piercing procedures are the same as those in other body art procedures. You can only pierce earlobe and ear rim with the piercing gun. Use a single-use piercing needle with a slightly larger gauge than the ornament being placed. Jewelry used in a piercing procedure needs to be made of surgical-grade stainless steel or solid 14K gold. All reusable equipment and tools must be sterilized after each use. Post-care instructions. After a body art procedure is finished, the entry points created on the skin are still at risk of infections. Therefore, you, as a body artist, must inform your clients on how to properly care for their newly created body arts before it is sufficiently healed. Avoid giving just a list of instructions, as people tend to skim through and may not fully understand the instructions. Instead, take time to go through the instructions with your client, allowing them to ask questions if there are any. After a traditional tattoo procedure, the tattoo site is often bandaged to keep any dirt or germs to enter the body from the open cuts on the skin. However, permanent makeup procedures do not require the site to be covered after procedures. Instead, the body artist will apply a thin layer of antibiotic ointment or cream on the site. In this case, the ointment or cream acts as a protective layer against any pathogens. Clean the tattoo site with an antimicrobial soap after removing the bandage in a few hours. The soap should not be abrasive or fragranted, as it will fade the tattoo ink. After washing or showering, apply a thin layer of antibiotic or white petroleum ointment given to you by the body artist to protect the skin. Remember to only use a thin layer so the skin can breathe. For body tattoos, it is a good idea to keep them bandaged to prevent the newly tattooed site from scratching or rubbing against surfaces. The bandage should be changed twice daily. The skin should also be hydrated until the tattoo has sufficiently healed after 2 to 4 weeks. Before the tattoo is fully healed, avoid soaking it in water, including swimming pools, the ocean, hot tubs, and saunas. It is okay to shower, but avoid direct water stream. The client may apply a thin layer of petroleum ointment on the tattoo area to prevent water from coming into contact. Do not expose the newly tattooed area to direct and excessive sunlight or tanning until the tattoo has completely healed. A few days after the initial procedure, the skin will heal, resulting in peeling, itching, and scabbing at the site. The client must not scratch the skin, as it may create an entry point for pathogens to enter the bloodstream and cause an infection. As the tattoo heals, pay attention to the tattoo site to see if there are any signs of infection. It is important to detect the infection as soon as possible in order to effectively treat it. Swelling, tender, and red or purple skin are signs of staph infection. HIV and hepatitis symptoms include fever, fatigue, and other flu-like symptoms. Also, pay close attention to headaches, blisters, and rashes. Ask the client to contact a healthcare provider or a doctor right away if they suspect they may have been infected. Post-exposure prophylaxis must be started within 72 hours of the exposure. Infection Prevention Control Plan. In a body art facility, exposure incidents are bound to occur even though you taken every precaution and preventive measure. There are two main categories of exposures. 1. Sharps injuries, injuries caused by accidentally poking, cutting, or scraping the skin with a sharp, including but not limited to a needle. 2. Blood, body fluids, or opium directly contact the eyes, mouth, or an open wound. Should a body artist not follow proper precautions, they may be at risk of innumerable incidents at the workplace. For instance, if you run out of ink in the middle of the procedure and decide to restock the ink with your gloved hands. Now you have contaminated the ink bottle and potentially the ink with the pathogenic blood on your gloves. The pathogens will then be transmitted to the next clients when you choose to use the same ink. Or say you discarded a needle in the regular waste container instead of the sharps waste container. The needle will poke out from the trash bag and injure you when you take out the trash. The most common diseases that most commonly transmit through a needle stick injuries or blood-to-blood exposures are hepatitis B, hepatitis C, HIV. However, hepatitis B vaccine will effectively protect you from contracting the disease from any exposure compared to a 6 to 30% chance of infection on unvaccinated individual. You can find more information about hepatitis B, hepatitis C infection rate from sharps incidence and blood splash are relatively small, about 1.8%. There is currently no vaccine available for hepatitis C. The infection rate for HIV from a sharps injury or blood-to-blood contact is 0.3%, whereas from an exposure to the eye moth or membranes is 0.1%. You should always follow universal precautions to prevent bloodborne pathogens from entering your body and your client's body even though the rates of infection are relatively low. However, should you or your client has an exposure incident, follow the instructions from the Infection Prevention Control Plan to minimize the chance of infection. Body art facilities in California are required by law to have an Infection Prevention Control Plan (IPCP) available for employees. In the IPCP, workers should be able to find sections on how to recognize, prevent, and deal with exposures, including decontamination and disinfection, proper sharps waste disposal, sterilization and storing reusable equipment, set up and disassemble, prevention of cross-contamination, post-exposure procedure. Imagine a typical day at work. You have just finished a tattoo procedure and cleaning up your workspace. As you are discarding the tools and wastes you produced during the procedure, you try to recap a needle and accidentally slip and stick your hand with the needle. Recapping needle using both hands increases the risk of a needle stick injury. If at all necessary, use the one-hand scoop method to recap the needle, otherwise discard the needle without recapping it in a sharps waste container. When you think you may have been injured or contaminated, follow these protocols. First aid, immediately wash the affected area with soap and water. If you are injured by a needle, allow the wound to bleed freely. Do not rub or scrub the affected area. Do not use a disinfectant or antiseptic on the skin. Immediately notify facility owner, safety manager, and healthcare professionals to seek advice to start post-exposure prophylaxis (PEP) for HIV and HBV. Perform a risk assessment by determining the exposure sources, type of fluids, and type of exposure, and medical information, either through interview or consensual testing. Under no circumstances should you reach into the sharps waste container to obtain used needles, razors, or blades for testing. Start PEP even if test results are not available yet, since PEP is most effective in preventing infections within the first 72 hours. Employers must provide training for bloodborne pathogens exposure before an employee starts and once a year after the previous training at no cost to the employee during working hours. Training is also required when a provision or addition, including introduction of new engineering, administrative or work practice controls, modification of tasks or procedures or institution of new tasks or procedures, is made. The employer must maintain an accurate record of each occupational exposure.